Hi guys, it's me, Professor Dean. Welcome back to my YouTube channel. On this video, I'm doing another Kahoot, and I'm going to be going over nursing exit concepts to know. Here's a couple things. I've gotten a couple comments, more than a couple, asking me about the lessons. And let me tell you what's going on. My document camera is down. I have like 7 of them, and I was only able to find 3 of them. All 3 are not working. I had to order another one. I'm waiting for it to come in. As soon as I get my new one, I will be resuming the lessons via lecture. So that's that. And the second comment I'm getting a lot of, Professor D, where are you? You haven't been posting much. Well, there's a reason for that. I'm on vacation. June, July, August. Yeah, you're not supposed to be seeing me at all, right? I'm on vacation. June, July, August. The only thing I'm supposed to be doing is my NCLEX reviews that I do every Monday and my one-on-one tutoring sessions that I do for about 2 hours. 2 hours, Tuesdays and Thursdays. That is it. So any videos that you see that I release, it's an extra, it's a bonus. I am not back officially until September. I'm living my best life right now and I'm enjoying it. But anyway, so that's why you guys haven't seen me post much lately, and you will not see me posting much lately until, like I said, September. But anyway, in this video, I'm going to be going over nursing concepts that are important to know. If you have an exit coming up, HESI, ATI, even studying for NCLEX, these are important topics that you need to know. They are going to be via live that I do on TikTok. You 99.9% of the times when you see these Kahoots, they're lives, and they're lives from TikTok. So I go live on TikTok and I record it at the same time. Now, before I get started, as always, guys, I'm going to ask you to please support me and support this channel. Go ahead and give this video a thumbs up. You're going to love this video. Go ahead and like it now so you don't forget. Subscribe to my channel if you haven't done so already. And don't forget, I'm now offering next generation NCLEX reviews. You can reserve a review. You can reserve a one-on-one tutoring session by going to my website, nexusnursinginstitute.com. And while you're there, be sure to check out the audio lessons that I have available. All right, guys, without any further ado, let's get started. Nursing exit concepts that you need to know. Your patient just had a lumbar puncture and makes several statements. Which one should be investigated first? Would it be, I have a headache that worsens when sitting up, my skin feels itchy, I want to throw up, or I cough whenever I swallow? Which statement should be investigated first? Okay, very good. I have a headache that worsens when sitting up. And you're supposed to go to that headache because think about it. The patient just had a lumbar puncture. They just had some cerebral spinal fluid removed. What is going on? Is there a leak? Is there cerebral herniation? Is there ICP? What is going on? So the first concern, the minute you saw that the patient had a lumbar puncture, and they're saying every time that they sit up, their headache gets worse, that's what you need to be thinking about. You definitely need to be thinking about CNS, most likely, because here's what happens, guys. When a patient has a lumbar puncture, they're getting cerebral spinal fluid removed. And if too much is removed, what can happen? Herniation, deviation. So that's what we're going to be concerned about. You're caring for a patient newly admitted with acute pancreatitis. Which action has the highest priority? Is it going to be to initiate NPO status, provide IV fluids, give anti-nausea medications, those are your antiemetics, or evaluate the INO? Your patient comes in with acute pancreatitis. What is going to be your priority action? NPO, IV fluids, antiemetics, or INOs? Very good. NPO. if you look at the question, they have what? It's not even, look what kind of pancreatitis, acute. This is active, right? They have acute pancreatitis, inflammation of the pancreas. So our priority is going to be to prevent this from getting worse. This patient's going to be NPO. Number one, you want to rest that pancreas. You know, the pancreas is the only organ in the body that's both endocrine and exocrine, right? You want to rest the pancreas. So you're going to have the patient NPO. That's number one. And number two, they've got acute pancreatitis. They might have to be rushed into surgery at any time. So guess what? We need them NPO. So that is going to be your priority. Yes, it's important, give the patient fluids as needed. Yes, it's important to give them anti-nausea medications. They'll get that IV as needed. Yes, it's important to monitor their eye and nose, but when you have to prioritize out of 4 correct answers, which one is the most correct, you always have to think of safety. You always have to think about which one's going to keep my patient alive the longest. Select all that applies. Your post-op patient's been ordered to be on a soft diet. Which types of foods are considered to be soft? Select all that applies. Here are your choices. We have broccoli, Brussels sprouts, carrots, pasta, mashed potatoes, and pudding. So your patient is on a soft diet. Which foods are considered to be soft? Remember, guys, when it comes to select all that applies, you have to treat them as true or false individually. Broccoli, Brussels sprouts, carrots, pasta, mashed potato, pudding. All right, guys. So the correct answer is pasta, mashed potatoes, pudding. These are considered soft. And so the way I want you to think about what would be soft, think about foods that people regularly eat and the texture of that food. So broccoli, people that regularly eat broccoli, do they eat it raw and hard? No, it has to be cooked. That's hard. Brussels sprouts. By the way, when it comes to Brussels sprouts, if you get a question about gas forming foods, Brussels sprouts is going to be one of them. Even though Brussels sprouts are high in fiber, they are gas forming foods. So patients who just had surgery, Brussels sprouts and broccoli would not be a good option to give them. Even though they're high in fiber, they are gas forming foods. Anyway, moving on. Carrots, same thing. Pasta. Well, you have to boil pasta in order to eat it. You can't eat it raw. Mashed potatoes, pudding, pasta, mashed potatoes, pudding, those are soft because when the person normally eats them, they're going to be soft. So just kind of think of the texture of the food. And again, I want to bring to your attention both broccoli and Brussels sprouts, because I've seen this before where NCLEX will try to trick you. They'll give you a situation, the patient who just had surgery, which would be a good option to give them, and you're thinking, okay, patient just had surgery, we don't want them to be constipated, most likely they may be on opioids for pain. Great, but at the same time, they just had surgery, especially if it's abdominal surgery. We don't want them to have any gas forming food, so please just keep that in mind. You walk in your patient's room and you note bright red bleeding on the sheets of your patient's bed. What is going to be your first action? Are you going to change the sheets? Are you going to call the doctor? Are you going to call a code? Or are you going to look for the source of bleeding? What is going to be your first action? You walk into your patient's room and you see bright red bleeding on the patient's bed. Change the sheets, call the doctor, call a code, or look for the source of bleeding. All right, only one person said, you're going to call a code because you see bright red bleeding. So when you see bright red bleeding, that lets you know that the bleeding is fresh. The patient has active bleeding going on. So the first thing you're going to do, this is an ad PI question. You're going to assess. Assessment is anything you do to get information, guys. So whether it's asking the patient a question, hey, what's going on? Where's his blood coming from? Or doing a physical examination on a patient, that's an assessment. Looking through a patient's chart, looking through history, anything you do to get information, that is considered an assessment. And you're always going to assess before you perform a nursing intervention. So that's the first thing you're going to do. Look for the source of bleeding. When should you assess your pregnant patient for intimate partner violence? As soon as you suspect this may be an issue, when the patient presents with an unexplained or serious injury, once a history of alcohol or substance abuse has been confirmed, or as a routine part of every OB appointment. Guys, I'm sorry, I'm on vacation. I've got a house full of kids, so if you hear background noise, that's what it is. I'm sorry. Okay, so here's the answer, guys. It's going to be as a routine part of every OB appointment. So here's the thing. The most dangerous time for a woman in regards to intimate partner violence is during pregnancy. This is the time where she's most vulnerable, and this is the time if the excuse me. And this is a time where if violence is going to escalate, it's going to be during pregnancy. So every single time mom comes in for her well-being, she comes in for her checkup, you're always going to screen for intimate partner violence every single time. And let me say this, something else. If you suspect that your patient is being abused, you're never going to question them in front of the person you suspect that they're being abused. Matter of fact, this is one of the only situations that I can even think of that you're encouraged to lie in nursing. You're going to lie through your teeth. You're going to say whatever you have to say to get that patient away from the suspected abuser. Say that, oh, you know, we got to go in and do an MRI or CT scan, whatever you got to say, and tell them that no electronics are allowed to be in the room, because something that the abusers like to do is make them have the phone on speaker so they can hear everything that's being said. So, excuse me. You're going to get the person away from whoever you suspect of abusing them. And then you have to ask them directly. When it comes to abuse and it comes to suicide, you do not beat around the bush, because most people, they want to tell somebody, they want to reach out and get help, but no one's ever asked them directly. So you ask them directly. Are you being harmed? Are you being injured? Are you being threatened? Are you being abused by anyone? Okay, you ask them directly. Select all that applies. Which is a secondary prevention measure? So you know how you have primary, secondary, and tertiary. This question is, which one is a secondary prevention measure? Select all that applies. You guys know how to treat select all that applies as true or false. Here are your choices: mammogram, immunization, physical therapy, colonoscopy, visual screening, and speech therapy. Which ones would you consider to be a secondary prevention measure? All right, let's see how you did. So let's talk about this, guys. Secondary, correct. Mammogram, colonoscopy, and vision screening. You guys did great. Oh, I almost missed. No, I got the colonoscopy. You guys did great. Mammogram, colonoscopy, vision screening. So let's talk about the difference, because NCLEX absolutely expects for you to know the difference. And matter of fact, so does ATI and HESI. So with primary prevention measures, The patient doesn't have it, and you want to make sure they don't get it. So primary prevention measures would be things such as community education and immunizations. You're trying to prevent it. Secondary, that S for secondary, I want you to think about screenings, right? Secondary prevention measures, we think maybe they got it. We're going to check to see if they have it. And if they do have it, how far has it gone? That would be something such as a mammogram or colonoscopy, or screening such as vision screening or hearing screening, right? Tertiary prevention measures, they've got it. It happened. We just want to prevent it from getting worse. So tertiary would be something like physical therapy or occupational therapy or rehab. That is the difference. And you are absolutely expected to know that for ATI, HESI, and NCLEX. Don't say I didn't warn you. Which is the ideal position to promote breathing? Would it be placing the patient in a prone position, supine position, high Fowler's position, or Trendelenburg position? So for example, you walk into your patient's room and you see the patient short of breath, they're having difficulty breathing. This is a CHF patient, or they've got bronchitis, asthma, emphysema. What are you going to do? What position would you place them in? That's right, high Fowler's. Always, always. You walk into your patient's room and they're having difficulty breathing, before you give them oxygen, before you call the healthcare provider, before you do anything else, the first thing you are going to do is elevate the head of the bed. That is something simple and non-invasive that you can do to help that patient breathe better. Select all that applies. You suspect hyperosmolar, hyperglycemic, non-ketotic syndrome, and HHNKS, in your diabetic patient. So what are you going to assess for? You suspect HHNKS in your diabetic patient. What are you going to be looking for? Select all that applies. Here are your choices. Blood glucose level, WBCs, level of consciousness, vital signs, platelet count, red blood cell count. You suspect your diabetic patient is an HHNKS. What are you going to be looking for? Again, blood glucose levels, WBCs, level of consciousness, vital signs, platelet count, RBCs. All right, so let's talk about it. Absolutely, blood glucose levels. This patient's blood sugar is so high. We need to know how high it is. We're going to be looking at the blood glucose levels. And as we're giving this patient insulin, right, to bring down the blood glucose, we have to make sure that it's actually working. So we have to keep checking the blood glucose levels. Not WBCs. White blood cells are important for what? Fighting infection. So this would be something, if our patient had an infection, we'd be looking at the WBCs to see if they're going down. Absolutely, to level of consciousness, because as that patient's blood glucose levels get so high, they can what? Go into a coma. So we absolutely need to be checking their cognition and their cerebral status. Absolutely, the vital signs, because as that blood sugar is going, as that blood sugar is increasing, their vital signs, guys, the heart rate can go up. We're going to be looking at that blood pressure. And something I didn't add here, but it's very important, we also need to be looking at that urine output. Okay, and we need to keep testing that urine for glucose. Platelet count, know the platelet count, because when you're thinking of platelet count, you're thinking of what? Bleeding, you're thinking of possible clotting disorder. So we'd be looking at platelet counts when we're concerned about our patient either clotting too much or bleeding too much. RBCs, no. RBCs, remember, red blood cells, those are, you know, part of the blood. Hemoglobin is part of the RBCs. Oxygen is carried in hemoglobin. So you'd really be caring about the RBCs if, your patient was bleeding out, we had internal hemorrhage going on, or maybe your patient was anemic. Then we'd be concerned about the RBCs, but not so much for the patient who's hyperglycemic in HHNKS. So for HHNKS, you definitely be looking at the blood glucose levels, level of consciousness, always vital signs, just those three. All right, let's move on to the next one. You're teaching a new diabetic patient how to self-administer insulin. Which is the best to evaluate the effectiveness of teaching? Is it to assess the patient's readiness to learn? Is it to observe a return demonstration from the patient? Is it to assess the patient's prior knowledge of self-administration? Or to have the patient list the steps for insulin administration? Which one's going to evaluate the effectiveness of teaching? Okay, most of you guys chose the correct answer, observe a return demonstration from the patient. Whenever you want to evaluate the effectiveness of teaching, you're going to have the patient teach it back to you. Either do a return demonstration or explain to you what you just explained to them. That's how you evaluate the effectiveness of teaching. Now, I saw 9 of you guys chose assess the patient's ready to learn, and another 7 assess their prior knowledge. I want to talk to you guys about this because this was a trick question. So I want to show you the difference. If the question asked you what is going to be a priority before teaching a patient, so you're getting ready to teach a patient about whatever, diabetes, doesn't matter, which would be a priority, then you'd assess their readiness to learn, because that's absolutely is a priority. You can have all the information in the world, but let's say you have a patient that just had a mastectomy and you're about to teach them to care for that wound site, but they're still in denial. They don't even want to look at that breast. Do you think they're ready to learn? Absolutely not. So before teaching, you need to assess the readiness to learn. And yellow, where it says assess the patient's prior level of knowledge, absolutely. Before you start teaching, you need to know how much the patient already knows. Imagine you're about to teach a patient about insulin. You're about to teach your geriatric patient about insulin, and come to find out this geriatric patient was an endocrinologist for 50 years. How silly will you feel, right? So you always want to assess their level of understanding, because you were about to teach up here and you realize that they only have a 2nd grade education, and so you have to start here. Or the opposite, you're going to start here and you realize they know a lot more. You don't insult their intelligence. You're going to start up here. So you always want to assess their readiness to learn, and you want to assess the amount that they already know. That is prior to teaching. But if you have already taught and you want to assess their understanding, it's going to be a return demonstration, or have them explain back to you what you taught them. Your patient with chronic back pain is being treated with ibuprofen and now reports stomach pain and weakness. What labs are you going to be checking? Is it going to be the ESR? Is it going to be the hemoglobin? Are you going to be looking at the patient's calcium level, or are you going to check their WBC? Your patient has chronic back pain. They've been taking ibuprofen. Now they're complaining of stomach pain and weakness. What are you going to be looking at? ESR, hemoglobin, calcium, or WBC? Very good. Most of you guys chose hemoglobin. Remember, I told you maybe about 2 questions ago, when it comes to, well, actually that was RBCs I was talking about. But anyway, with hemoglobin, when you see RBC go down, you see H&H go down, that patient may be bleeding out. This patient has chronic back pain. They've been taking ibuprofen. They've been taking ibuprofen, naproxen, any NSAID that can place the patient, they can have gastric ulcers, and the ulcer can start bleeding. So we want to make sure that the patient isn't bleeding out. So we're going to be looking at the red blood cells. We're going to be looking at the H&H. We're going to be looking at the hemoglobin. We want to see the hematocrit. Hemoglobin is the correct answer. Let's talk about ESR. I saw that 16 of you guys chose ESR. ESR is more for inflammation. If patients got inflammation going on in their body, we're going to see the ESR increase. Calcium level, calcium would, for example, if you have a patient that has ingested an excessive level of calcium, or the kidneys aren't working, they've got kidney disease and they're not excreting enough calcium, that can cause them to be hypercalcemic. But you wouldn't expect it with this type of patient who's taking an NSAID for chronic pain and now for back pain, and now they've got stomach pain. That should lead you to think about, okay, they probably got a bleeding ulcer. And of course, WBC is more for infection. So the correct answer here is hemoglobin. Which patient would you assess first? So you got 4 situations. Which patient are you going to assess first? Is it going to be a 72-year-old that's 1 day post hip replacement, a 37-year-old with nephrolithiasis in need of urine straining, a 23-year-old 1 hour, oh, I didn't even finish that one. Oh, I'm so sorry. Or 42-year-old admitted with depression and suicidal thoughts. I'll give you a hint. It's not yellow. Whatever I was going to write and I didn't finish, that's not the answer. Very good, guys. Your suicidal patient. Your patient that is admitted with depression and they're having suicidal thoughts. Guess what? That patient is not considered to be stable or non-suicidal until you assess them. They come in admitted with depression and suicidal thoughts. You are assessing them first. That's number 1. And number 2, you're putting them on one-on-one supervision. They go to the bathroom. Guess what? The person who's with them is right there watching them, right? We're not going to close the door and let them go to the bathroom in private because they might while the door is closed. Whenever you get a test question asking you which patient you're going to assess first, what they're really asking you is who is in most danger of dying the quickest. Your patient has been prescribed a low-fiber diet. Which food choice is in compliance with this diet? Low fiber. Would it be mashed potatoes and broccoli? Would it be whole grain cereal? Would it be steak and carrots? Or would it be baked chicken and pasta? You're looking for which meal would be a low fiber diet. Okay, so most of you by a hair chose the correct answer, baked chicken and pasta. That's, out of all of these choices, this is the one that's lowest in fiber. If you look at the red, mashed potatoes and broccoli's high in fiber. I just talked to you guys about that. Whole grain cereal, those grains high in fiber. Steak and carrots high in fiber. So out of all of these, the one that's lowest in fiber is going to be your baked chicken, which is high in protein, and the pasta, which is high in carbs. You're teaching a group of teenagers how to reduce the risk of Lyme disease. Which teaching would be most appropriate? Would it be hand hygiene? Would it be drinking at least 2 liters of water daily? Would it to keep the skin covered and protected? Or would it be to avoid sharing headgear such as hats and scarves? I am so proud of you guys. I thought that most of you guys were going to be fooled and choose hand hygiene, but you guys understand that it's going to be keep the skin covered and protected, because how is this transmitted? It comes from that tick, right? So you want to make sure you teach your patients, when you're educating them, to wear long pants and to make sure that they tuck the pants inside of the sock, and to wear long sleeves, and to make sure that they keep their skin protected so they don't get bitten by the tick, because that's how it's transmitted. Very good. And I see 4 of you guys chose avoid sharing headgear such as hat and scarves. You guys are thinking about head lice. Your patient just delivered a healthy baby 48 hours ago. Which findings should be reported to the healthcare provider immediately? Would it be WBC of 15,000? Would it be a fundal deviation to the left? Would it be firm breasts or an oral temperature of 100.7? Your patient just delivered a healthy baby 48 hours ago. Which one are you going to report to the healthcare provider immediately? Wow. Okay. 32 of you guys chose fundal deviation. All right. That's wrong, but I'll get to that in a second. Let's talk about the correct answer. 17 of you guys chose very good. Oral temperature. That we're going to report. What are we concerned about? We're concerned about infection. Notice the time frame, and the time frame is going to make a difference. 48 hours ago, immediately in the postpartum period, we expect the temperature may increase just slightly because the metabolic rates increased, right? And we also expect to see the WBCs increase. WBC is usually supposed to be 5 to 10,000, but postpartum, we absolutely expect to see it increase, and it's going to go down. That is normal. But after 48 hours, that temperature 100.7, we're going to be concerned. We're going to report that because that may be a sign that the patient's developing an infection. Now, let's talk about the other two. I'm happy only one person chose firm breast. Firm breast is normal. What do you think is causing the breast to be firm? Milk. She just delivered a baby. She's got milk in her breast. Her breast, firm breast, we're not going to report that to the healthcare provider. And fundal deviation. 32 of you guys chose this. Let me talk to you about fundal deviation. When you see fundal deviation, you need to be thinking of a full bladder. Most likely what's happening is she's got a bladder full of urine, and so that bladder is pushing against the fundus and causes the deviation. So you're going to help mom to go use the restroom. When you see fundal deviation, you should think a full bladder. When you see soft fundus, you should think of massaging the fundus. Which patient should you see first? In other words, which patient's the priority? A 42-year-old male with a temperature of 100.3 and a headache for the past 24 hours, a 16-year-old female with right great toe redness, pain, and swelling, a 23-year-old female patient reporting white curdy vaginal discharge, or a 52-year-old male patient reporting chest pain after eating a large spicy meal. Very good. I'm so happy you guys did not get tricked, because that's what NCLEX will try to do to you too, right? They'll give you the large spicy meal to make you think, oh, it's just GERD. We don't know it's GERD until we assess them, right? Chest pain, that's going to be a problem. And it's going to be a problem until that patient's assessed and is deemed otherwise. When you see a question asking you which patient you're going to see first, what they're really asking you is which patient's the priority. And when it comes to priority, you always have to think about what is going to kill your patient the fastest. You need to be thinking about what falls under physiological integrity, okay? 16 of you guys chose the 42-year-old with a low-grade temp and a headache for past 24 hours. Yeah, that patient should be assessed, but they will not trump that patient that may possibly be having a heart attack, and we're not going to know until they're assessed. 16-year-old female with right great toe redness, pain, swelling. Okay, maybe she's got gout. We don't know, but again, that's not as deadly as a possible heart attack. And then the 23-year-old patient reporting white curdy vaginal discharge. Maybe she's got a yeast infection. We don't know, but guess what? It's not deadly, right? Like a heart attack is. So you always have to think in terms of which can kill your patient. Last question. Which symptom should be assessed first? In other words, which one is priority? In other words, which one is most deadly? Is it headache fever, photophobia, nuchal rigidity? Would it be fever, rash, cough? Would it be nausea, vomiting, headache, or back pain, headache, right foot swelling? So when you see these symptoms together collectively, which one should be sounding off alarm bells in your head? And you're going to assess that patient first. Very good. Very, very good. The minute you see headache, fever, photophobia, nuchal rigidity, you see them together, you see them clustered, you better be thinking of meningitis. And when you even suspect, it's not confirmed, you suspect a patient has meningitis, you're automatically putting that patient in isolation because you have to protect the public from that patient, right? You're going to go ahead and get cultures. You're going to go ahead and give antibiotics. And the patient has to be on antibiotics for a full 24 hours before they can even come out of isolation. So you better be thinking of meningitis. Something else about meningitis that NCLEX loves to test you on. So make sure you know our risk factors, older adolescents and young adults, especially those going to areas where it's very crowded, such as the dorm or in army barracks, or also in prisons, right? So make sure you guys know those signs and symptoms. All right, guys, that was it. So let's see how well you did.